Lung cancer screening is a free NHS check for people aged 55 to 74 who've ever smoked. It's called a lung health check. These checks help find problems early, like lung cancer, when they can be easier to treat. If you're invited, it's a good idea to have an appointment. Lung screening helps people stay healthy.
I got this letter from the NHS. I think it's about lung cancer screening. I'm a bit scared about it. It sounds a bit serious.
It's not scary, it's just for people that have smoked.
They don't think I've got lung cancer.
It's just a phone call, no hospital trip, unless you need it.
So I think there's nothing wrong.
It helps people spot any problems.
That sounds all right. I'll give it a go.
If you're invited, the first step is a phone call with a nurse who knows about lung health. They'll ask questions about your breathing and lung health, whether you smoke now or used to, any chest infections or allergies.
Current smoker or an ex-smoker?
I used to smoke then, but I give it up.
They'll also talk to you about keeping your lungs healthy. The call takes about 20 to 30 minutes. If the nurse thinks it could help, you'll be invited for a CT scan. This is a quick, painless scan that shows pictures of the inside of your chest. It might take place in a hospital or a special van near your home. You might be asked to come back in the future for another scan, just to keep an eye on things. Sometimes, people are also referred to other services to help them stay healthy. Getting your lungs checked gives peace of mind and helps find problems early. It's your choice, but saying yes could help you stay healthy. Questions and answers.
What is a lung check and why have I been invited?
So you've been invited in because you're between the ages of 55 and 74, and I'm presuming at some point you may have been a smoker or you're a current smoker. And at the lung health check, you will have a discussion with a nurse and she'll do a brief health check to see how you're getting on at the moment. And then you'll be given the opportunity to go through a risk assessment to see if you're eligible for one of our CT scans to have a closer look at your lungs.
Will I have to go anywhere or will everything be done from home?
So your consultation will be done over the telephone. It takes about 20 minutes. You can be in the comfort of your own home, or if you would like, alternatively, we do face-to-face consultations if you'd like to come with somebody to accompany you into the hospital, and you get an hour's appointment then.
Can the nurse speak slower for me to understand?
Yeah, that's not a problem. Once you get your invitation or your letter or your text, please phone our admin team and let them know that you would either require an extra long appointment to accommodate this, or when you're first phoned by the nurse, one of the initial questions the nurses will ask you is, do you have any specific requirements? That will include things like, do you need any help with your hearing, your sight, your mobility? They'll also ask if you have any requirements like needing extra long on the call. So if you just alert that to the nurse, and they will give you extra time and speak more slowly and give you extra time to ask more questions.
What kind of questions will I be asked?
You'll be asked questions about your current symptoms. So do you have a cough, any chest pain, any shortness of breath? Any abnormal weight loss or loss of appetite. You'll be asked if you've been coughing up blood. You'll also be asked if you're on any medication for your heart, such as cholesterol lowering medication. If you have any background illnesses such as asthma or any conditions such as COPD. We'll also ask about your smoking history. So it would be ideal to try and remember how old you were if you started smoking and when you stopped, and try and remember how many cigarettes you used to smoke a day. All these things will be asked throughout the consultation. And then when we do your risk assessment to see whether you're eligible for one of our CT scans, we'll ask questions like, have you had pneumonia, any history of bronchitis, or if you've ever been diagnosed with tuberculosis. We'll also ask if you've had any exposure to asbestos at all, and if any of your family have ever been diagnosed with lung cancer, and if they were under the age of 60 or above the age of 60 when they were first diagnosed. We also need to know what your height and your weight is before you attend for your appointment. And all these contribute to us calculating your risk score. At the end, the nurse will go through some red flag warning symptoms that you need to be aware of in the future. You can share these with your friends and family as well so they can be aware. And then we'll also go through some health promotion with you.
What happens if the nurse thinks I need more tests?
If the nurse thinks you need more tests, for example, we do refer patients on for some breathing tests sometimes, especially if they've had symptoms from their smoking history, such as a cough or shortness of breath. Then we'll explain what the tests are for and what happens, and we would refer you on through the services. If we think you are eligible for one of our CT scans, we'll explain exactly what happens during the test, what will be expected during the test, for example, the CT scan, and what the risks are. Nothing's ever just left. Everything is explained in detail. And if you have any questions, you're given opportunity to ask questions. We don't know how long some of the tests might take to do, for example, any breathing tests, but we can give you an idea how long it would take to have your CT scan and how long the results will take.
Are there any side effects to the CT scan?
We use a low dose CT scan, so there shouldn't be any side effects. You're not given any dyes or any medications or any drips. The scan literally takes seconds rather than minutes to take. You lie down on a bed, they'll ask you to put your arms above your head, and the bed will go through the big donut-shaped scan. They may put you through twice, once for getting your measurements. They'll just say, hold your breath, and you'll come out. Most of our scanners are in a supermarket near where you live, and you can come out and go straight away and do your shopping or go home. You won't feel any side effects from the scan at all.
Lung screening helps people stay healthy.